Hello ladies and gentlemen, I'm Stewart Bishop. I'll be leading this tutorial today. This will be covering the fall 2015 semester at Washburn University in the Pathophysiology class taught by Professor Sue Unruh. And the topic of this particular video is going to be Module 2, Unit 2 on the inflammation system. We will be using a couple of guides here. One, of course, is our McCants book that you're very familiar with. I'll be showing you some key parts out of that I think will help to get you up to speed with inflammation very quickly. And also I have got some drawings of my own that will familiarize you with some of the basic processes involved in inflammation. It's important to recognize that inflammation is one of the most widespread conditions that we can ever encounter. It can be in response to any insult to basically to the capillary bed. It can be as a result of trauma, as a result of a disease, as a result of a pathogen like bacteria or virus. It can be as a response to an allergen. We see this process of inflammation is just a universal response. Keep in mind that inflammation is part of the innate immune system. It is not specific to any one particular cause, unlike the acquired immune system, which is specific to a particular pathogen. And with that in mind, we'll go ahead and turn the camera towards the monitor and go from there. Okay, ladies and gentlemen, before we get into the PowerPoint for the course, I want to turn to a couple of very important parts in your McCants book. Of course, this is the section on innate immunity or inflammation. And a couple of the areas that I'd like you to focus on that I think can really bring you up to speed. The first one is this table here. And by the way, my edition is maybe a couple years before your edition, or vice versa. So you may be in another chapter, but this is my table. It's entitled Overview of Human Defenses. And notice that in the innate immunity area, you have barriers like skin and hair and the pH of the skin and so forth. And then you also have the inflammation. This is part of the innate system. It's not specific to any one particular pathogen. Whereas over here, the third line of defense is called the adaptive or the acquired immune system, which is a learned system. As the body is exposed to various pathogens, that system will adapt and acquire new immunity against it. This is a picture just of the barriers between the internal organs and the environment. And of course, all of these barriers are part of the innate system. And the most important barrier of all, of course, is skin. The next section I want to point out to you, you want to read and familiarize yourself with this section called Second Line of Defense, Inflammatory Response. You need to learn this material cold. And also familiarize yourself with the idea that there are basically three things going on in basic inflammation. You have degranulation of the mast cells, you have activation of plasma systems, which include the complement and the clotting and the kinin systems, and then you have cellular products that are released, and these are released from the cells, and basically these products serve to either dilate the blood vessels, to call up other parts of the immune system, to increase the temperature a little bit. That is to create a fever and so forth. They serve different functions. We'll get into all of those. Now, the end result of all of this is the classic signs of inflammation. Redness or heat, and that's caused by the vasodilation, the swelling or edema because the blood vessels become leaky, infiltration by cells such as neutrophils and eosinophils and macrophages. These are white blood cells that come in and eat the invading bacteria or the invading like a splinter or whatever it may be. And then you have formation of blood clotting, and then you have stimulation of nerve endings creating pain. Okay, those are the classic signs of inflammation. You need to familiarize yourself with that. We'll go into details on all of these. You need to learn, you need to read the portion about the complement system. Okay. Now, this particular diagram here is going to give you, this is kind of a reference diagram. I think I would come back to this after you've learned about the component parts. We will learn about mast cells and the idea of degranulation. And you'll see that in the mast cells, they have these little granules, and they contain things like histamine and chemotaxic factors and so forth. And if there is an injury to the body, these mast cells are going to release those granules. That's called degranulation. And that will in turn have various effects that we'll talk about. And a couple of the very important responders are neutrophils, these, and then the larger ones being macrophages. Now, neutrophils are both of these are what we call phagocytes. They eat things. The neutrophils are smaller and they're faster to arrive, and they are the first responders. The macrophages are larger. That's kind of the big eater, if you break down the meaning of macrophage, and they will come along later if the neutrophils can't resolve the problem. And they are actually called up to the scene through something we call chemotaxis. And that's a chemical messenger. One of the cells that sends out that chemotaxic messenger is the mast cell. And it will send a message saying, hey, we need more neutrophils to come over. We need more macrophages. So this kind of shows you a picture of what goes on when we have an injury to the capillary bed. Okay, and also something I'd point out to you, the mast cells are outside the blood vessel. They are here in the tissue or in the interstitial space, and inside the vessel we have something very similar to the mast cell. It's called a basophil, and we'll be showing you that in just a moment. Okay, some other things that are important. Let's see. Of course, everything's important. I wouldn't say any of it is not important. This is kind of a nice summary of a lot of the different topics you're going to hear about today. Cytokines like interleukin and tumor necrosis factor, histamine, chemotaxic factors for neutrophils, chemotaxic factors for eosinophils. Notice that this is a mast cell. And when it degranulates and sends out, it will send out histamine, send out chemotaxic factors, send out cytokines and so forth. And it also produces some materials called prostaglandin. And prostaglandin is a byproduct of another component in here called arachidonic acid. So we'll also pay attention to that. So this is another very, very important chart for you to take a look at. And I think this chart will make more sense after you've seen the rest of this presentation today. And here is a picture of phagocytosis. You don't need to maybe know all the details here, but just the idea that this is a phagocytotic cell, which could be a neutrophil or a macrophage. And you notice here it is taking in some bacteria. And it's literally surrounding the bacteria, and it's basically going to bring that bacteria inside and destroy it with components that are inside the cytoplasm of the macrophage. This is also a nice little picture. Here you see the neutrophils coming in. Now there's a splinter that happened. The splinter punctured the skin, and it created an injury. There's your local inflammation. You can see that. And so we have what are called chemotaxic factors that have been released, and the neutrophils are following that. The neutrophils are coming in through the bloodstream, and then they're going to leak out through the blood vessel, and then they're going to go to the site of the injury and start eating whatever is there. And notice some bacteria came in with the splinter, because this bacteria was on the outside of the skin, but when the splinter punctured the skin, that created that opportunity for the bacteria to come in. So this is also a very, very good simple chart for you to take a look at. And of course you want to read through everything involved here, but you know those are some of the high points that I'd like you to take a look at. Here this talks about mediators of inflammation. Now mediators are simply compounds like the interleukins, like the tumor necrosis factor, like the prostaglandins, the histamine, the bradykinin, and so on and so forth. It never hurts to come back and revisit all of these different compounds that are involved that call up the inflammation process. Also, here is a very important distinction between local inflammation. This will be inflammation that just occurs on a spot on your leg or your arm, whereas systemic inflammation will occur all over the body. And it's very important, Professor Unruh wants you to understand the difference between those two. Also, you have the condition of chronic inflammation. What happens if somebody is inflamed all the time? What would be a good example of a disease like that would be rheumatoid arthritis, for example. We need to know what occurs to the body during that process. And then the rest of the chapter talks about the healing process. And then last but not least, here you have something about aging, some of the differences in older adults. That is on your study guide. Okay, now, before we get too deeply into anything, I also have this drawing that I want to, and I'm going to be bringing this drawing up time and time again. It's about as basic as it gets, but it covers a lot of the important material for you to get your foundation. Over here we have the inflammatory process, and remember we said this is part of the innate immune system. It happens, it's not specific to any one pathogen or any one form of injury. It happens in response to everything. Okay, now, over here on the other side we have the acquired immune system, which involves other components like B cells, T cells, etc. Now, almost the first response to any injury or any break in the innate barrier is going to be almost always inflammation. We may or may see the immune system called up. But we will be covering this in the next unit. So we're going to be basically focused on the inflammatory side today, but then I want you to get the idea that these systems work together. It's kind of one big system, if you will. Now, very importantly for today's topic, we want to look at the start of inflammation. Now, this is the skin right up here. This will be your skin. This is the interstitial space or the tissue. And then this is a blood vessel coming through here. So this is the blood, and this is the interstitial fluid or the tissue. And what happens, let's say that we drove that splinter down, that splinter came down and it punctured a local capillary. We have what are called mast cells and basophils, and they're essentially the same thing. And you can just think B blood. Basophils are in blood, the mast cells are in the tissue. They have inside them these granules, and you saw that in your textbook. And they contain many things, but three of the most important compounds they contain is histamine, which is H, chemotaxic factors, which are what I'm abbreviating CF, and then something called arachidonic acid. Okay, now, if we have an injury, they will degranulate. They will release this stuff into the tissue and into the bloodstream. Now, we'll talk about the effects of each one of these things, One of them in particular, the chemotaxic factor, is an attractant. And it is going to attract some other components of the inflammatory system, and most specifically neutrophils, eosinophils, and macrophages. Okay, and these are the phagocytes. These are the things that eat things. And then there's also a system down here called the complement system, which really is just, it's not even cells, it's just pieces of protein that's floating around in the blood, but it's very important in response to any injury to the body. And then if that isn't enough, then we can always call up the really big players, which are over here in the immune system. And as I say, in reality, they kind of bleed together and work together to get the job done. But we will come back to this chart here, and hopefully this will demystify for you some of what you're about to see. Okay? So, with that, let's look at the PowerPoint, or the PDF. The body's line of defense, the first line of defense like we saw in the chart, this is the blue area is the environment. The brown area is the skin, and you notice the skin the skin is a physical barrier. It will keep bacteria out on the outside. Also, the skin has an acidic quality to it, which will help to kill the bacteria. And also you have some bacteria that actually is friendly bacteria that lives on the skin and will attack the dangerous bacteria. Now, that's the good news. The bad news is that we want that friendly bacteria to stay where it belongs. Like, for example, we want E. coli to remain in our intestines. We don't want it floating around in other parts of the body. Then, if we do get an injury, the second thing that will happen, if we break that barrier, we will get inflammation, and that's not specific to anything. But if need be, we can also bring up specific immune responses, and a lot of those are going to be triggered by what are known as antibodies. Antibodies are components of immunoglobulin that contain a memory of a particular bacteria or virus, and if it is exposed to that bacteria, it will respond. It will identify it as something that needs to be neutralized. Okay, and then we will pull up the T cell. You see that's a T cell there, and so forth. But we'll get into all these step by step here. Okay. Inflammation, just a kind of an overview of it. It includes chemicals and cells. It occurs in any tissue where there's vascularization, which is basically every tissue, because if a tissue didn't have any blood, it wouldn't be living. And it's nonspecific. It will respond to any insult, be it a trauma, be it a bacteria, be it an antigen or an allergen. You will get an inflammatory response. Inflammation can occur for a short period of time, or it can occur chronically, just going on all the time. And if so, then that's a chronic condition, lasting generally more than 2 weeks. Okay? And you can, of course, read the details that are involved with it. These are the cardinal signs, the basic signs of inflammation. And this is the Latin rubor, tumor, calor, and dolor. Rubor, of course, means redness. Tumor means swelling. Calor means heat, like calories. And dolor is Latin for pain. And those are the common cardinal signs of inflammation. The process. What does it do for us? It defends us against infection. It helps the tissues repair. It will destroy agents like bacteria and so forth. And it will also contain them. That's very important. The swelling and the influx of all these white blood cells, the neutrophils, the macrophages, they basically create a wall to limit the injury to the local area. And if need be, it can stimulate the immune system if need be. And then ultimately it promotes healing through either primary or secondary intention, and we'll get into that in a moment. Okay, now, when the injury occurs, there's various stages of response. The first is the vascular stage, where you have a damage to a capillary or an artery. And remember that we said that we have basophils that are located in the artery, and also the walls of the endothelium, or the inner lining of the blood vessel contains cells that will release mediators of inflammation. But probably the most important one is the mast cell degranulation. And remember, anytime you see mast cell, you can also think basophils. They're very similar in what they do. Just to kind of give you a little more background on that, mast cells tend to be specific to the tissue that they're in. So we have mast cells that are specific to respiratory system, specific to the digestive system, and so forth. Whereas basophils tend to be the same thing everywhere because they float freely in blood. Okay, the first thing that happens when we get an injury, a very brief period of time, we get a vasoconstriction. And that makes sense because we want to kind of control the leakage of blood. So that's the first initial, and the vessel kind of spasms a little bit. But in response to that spasm, we're going to start to see then a dilation, and that'll be the next step. The vasoconstriction is followed rapidly by vasodilation of the arterioles and venules that supply to that area. Okay, so we have an injury in this area. And what will happen is, this is the normal, these are the arterioles and these are the veins, and in between is the capillary bed. And what will happen is this will begin to dilate and make it possible for certain things to start leaking out into the tissue in order to start the inflammatory process. Now, these are just some cells that will be involved. They don't necessarily all occur at the same time, but I want to familiarize you with these. You have basophils here. Remember, and they're also like the mast cells. These are one of the first things that respond. They will call up the neutrophils. Anytime you see monocyte, that is a macrophage. That's just another word for them. And on a lab report, you will see neutrophils will be abbreviated NE, monocytes or macrophages will be abbreviated MO, eosinophils will be EO. Okay, and of course, all of those will be involved in and these are what are known as leukocytes or white blood cells. And then you have lymphocytes, which are, we'll talk about what they are in a moment. Now, this one here is important to know. These are what are known as band cells. And a band cell is just an immature neutrophil. And what happens is neutrophil is the most prevalent white blood cell or leukocyte in the body. Normally, about 60% of white blood cells will be neutrophils. But in a case of severe inflammation, the body is going to be calling up neutrophils that aren't even mature. They're called band cells. So on a lab report, on a lab blood report, if the patient comes back with a high band count, we call that bandemia or a left shift, and that indicates that there's a lot of inflammation going on. And you would see that in the case, for example, of acute appendicitis would be the classic example where you would see but anything where you have acute infection, acute inflammation of any significant degree, you will see a high count of bands. Now, mast cells, this is really kind of the start of the whole thing. They mature in the tissue. That's important. Mast cells are in the tissue. Basophils down here are in the blood. They react very similarly. They contain similar material. And the key is they have these little granules inside of them. And these granules contain, amongst other things, three of the really important products in there are histamine, chemotaxic factors, and arachidonic acid. And they probably contain some other products that we're not even really familiar with yet. By the way, the immune system is one of them, and inflammation is one of the most modern areas of research. If you were to look at the textbook on the immune system even 5 or 10 years ago, it would be vastly different than the information you see today. You talk about a system that's really on the cutting edge. You can't get much more cutting edge than immunology. All right. We have once activated, the mast cells release dozens of mediators. They release all kinds of this material, and we'll talk about what they do. Okay. Now, here's the first one that they release. Mast cells and basophils degranulate and they release histamine. So here's the histamine coming out, and it's really important to know what histamine does. Histamine causes vasodilation. So the blood vessels dilate, but the smooth muscle, especially the smooth muscle of the bronchial airways, will contract. And one of the reasons for that is that this system is kind of dumb. It's a very primitive system. It's been with us forever, and it basically thinks, okay, I better close the airway or reduce because maybe this person is breathing in something toxic. So as a response, you will tend to get a contraction of the smooth muscles of the bronchial airway. But you will get dilation of the blood vessels. And the reason the blood vessel dilates so that we can bring in more neutrophils. You know, notice how big this macrophage is. Well, what if we just opened up and dilated this blood vessel? Then we could get much more of these inflammatory and immune system components into the site of the injury. So that's why we get the vasodilation. And by the way, the blood vessels open, they get wider, and they also get leakier so that these products can leak out and go out into the surrounding tissue. Okay? And of course, I know you're gonna be reading up on some of these details. I'm kind of just giving you the background on it, and hopefully I can help demystify this a little bit. Now, the second product that is released from, again, here's the mast cells, and there's the basophil, and they are degranulating. They've released the histamine. Now they're releasing the CF, or the chemotaxic factors, and the chemotaxic factor will attract phagocytes. And remember, what are the phagocytes? Neutrophils, eosinophils, and eventually macrophages. The first responder will be the neutrophil. That's the one that's going to come immediately, and then the macrophages will come as needed. Okay, now, and we're going to get into details about what all happens, but we just want to give you the background on it right now. Now, arachidonic acid is a fatty acid that is in the phospholipids of most cell membranes, and it is released during tissue damage. That's important. So we've damaged that tissue. So in the endothelial tissue cells and in the mast cells and basophils, we have this arachidonic acid. And basically, there are two enzymes. So arachidonic acid is going to spill out, and there's two enzymes. One is going to be the cyclooxygenase, or the COX enzyme, and the other one is going to be lipooxygenase. Okay, now the COX enzyme will work on arachidonic acid and create what are known as prostaglandins. Okay, the lipooxygenase will act on it and produce what are known as leukotrienes. And notice what they do here. The prostaglandins will increase the permeability. So again, it will make the blood vessels more permeable, but it also will sensitize the nociceptors. And nociceptors are the noxious nerve endings, so that will help us be sensitive to pain. So this is one of the things that creates the pain. Well, also notice that the leukotrienes, they also will sensitize the nociceptor, but they do something really important. That's they add to that smooth muscle constriction similar to the histamine. That's why somebody that has asthma may take a leukotriene modifier to reduce the constriction that's caused by the leukotriene. Also, because this creates pain, we can give a medication like aspirin or a Advil, and that will block the downstream. It will block the downstream pain effect of the prostaglandins. Now, if we were to give a steroid actually blocks both of these. And we'll get into that in a moment. But just to kind of give you a little background here on the arachidonic acid and what it does. All right. Now here it gives us a more complete picture. The basophils and the mast cells, and they're releasing the histamine, the chemotaxic factors, they've already released the arachidonic acid. Remember, the arachidonic acid is going to break down into leukotriene, and the leukotriene is going to result in that smooth muscle contraction of the bronchial airways. Meanwhile, they are all going to increase that permeability, and also the arachidonic acid is going to sensitize these nerve endings to pain. Okay, and you can read a lot about the COX-1 and COX-2 pathways, very important to keep in mind. And we have medications that operate on these two pathways to reduce pain. Okay, and this is the leukotrienes. And this slow reacting substance of anaphylaxis, that kind of speaks for itself, SRSA. If inflammation were to go on systemically, we would have what's called an anaphylactic response, or systemic inflammation. And these are one of the potential drivers of that if it's not contained in a local area. Now, as far as the pharmacology of arachidonic acid, and we talked about this, here's your arachidonic acid, and here are the two pathways. Here's the COX pathway producing prostaglandins, and here's the lipooxygenase pathway producing leukotrienes. Notice that if we give somebody aspirin or an NSAID, we are going to relieve this pain that's caused over here, but we're not going to do anything to stop the smooth muscle contraction and the leakiness that's caused by the leukotrienes. However, if we give a corticosteroid, we will block both pathways. It's important to know that. Let's see here. Now, something else, just to kind of give you a heads up here, prostaglandins also contribute to platelet activation, and when you give somebody an aspirin, that's going to block the prostaglandin production, and aspirins also will render platelets ineffective. That's why somebody that is on an aspirin medication to keep their blood from being too sticky, they will have a greater tendency to bleed. Because one of the reasons being that this pathway is blocked. So that's another function we don't really get into here, but it's certainly there for you to keep in mind. Now, we do have drugs that are just strictly COX-2 inhibitors, but they've been shown to have an increased risk of heart attack and stroke. It's good to kind of read up on the COX-1 and COX-2. Okay, cellular components. We have two classes of white blood cells. We have those that are granular, that is, they contain these mediators that are released. Mast cells and basophils are the main ones there. And then we have ones that are agranular, and they really don't release much. They're just there to do a particular function. And the monocytes or macrophages, again, that's a word for the same thing, are in that category. Okay, now let's look at the neutrophils. Remember, we said those are the first to respond. They can come very quickly, and they respond to those chemotaxic factors. They eat bacteria, fungus, debris, of anything that's a foreign substance. They do not live very long, 4 or 5 days, and after they have eaten, they will die. And basically, when they die, they create that substance, the yellow substance that we see, called pus. And that's really a white blood cell that has eaten something and then died. Typically,